This morning on The Blend, we have with us Dr. David Anderson, who's the Associate Professor and the Director of the Women's Imaging Center at Michigan State. Welcome.
Thank you very much.
So when and why should women start getting the mammograms?
Right. So what we recommend in radiology is to start at age 40 to have a screening mammogram and have a mammogram every year. And so that's what we recommend, and that's what we advocate.
Is there something that women should do besides that as well?
Well, it's good to be familiar with your breasts, so if you feel comfortable doing breast exams, do that. Definitely go see your health professionals, have breast exams. If you know your family history, that's helpful too.
And when you go to get that exam, I know MSU Women's Imaging Center does that. Why choose MSU Women's Imaging Center?
Well, first of all, we're very convenient. It's easy to get to. We have free parking. Our technologists are very experienced. I think our staff is very friendly. The people at the front desk all the way through the exam are all great, I think, and so they're very welcoming.
And tell me a little bit about the procedures that you will do at the MSU Women's Imaging Center.
Right. So if we find an abnormality on a mammogram, we may end up doing an ultrasound. We can do biopsies. If we're trying to find a breast cancer, we may do what's called a stereotactic biopsy, which is a mammography-guided biopsy. We may do an ultrasound-guided biopsy. And also at MSU, we have capability to do a breast MRI biopsy.
And it all kind of leads down to early detection. I mean, if you detect it early, your chances of survival are greater, correct?
Oh, absolutely, yeah. So the earlier you find it, the better off. And you have less invasive treatments, better survival rates. So it's good to get out there and screen early.
Now, if women have breast cancer in their genes, their mother or their grandmother, should they get, that mammogram earlier than 40?
Well, yeah, they could. It's possible. If you have your mother at 35, we'd probably want to start you maybe 30. Mm-hmm. If you have a gene mutation, then we'd also recommend, in addition to mammography, do breast MRI every year.
Okay. If you'd like more information on this, you can get a hold of Dr. Anderson. We're going to put the information on the screen. There it is, the MSU Women's Imaging Center. And you can visit healthteam.msu.edu, of course, for more information, or give them a call at 353-4920. Doctor, thanks so much for being with us. And really, it's, getting that detection and getting it